Don't worry.
Okay. Artificial intelligence in healthcare. Okay, so this is an overview of what we're going to talk about. First, we're going to have like an introductory video, and then I'm going to talk about the history, like the birth of the actual term artificial intelligence, and then some of the first systems that were used in healthcare specifically. And then Adam's going to talk about pop culture, modern AI, and then we're going to talk about the future of AI in healthcare and some ethical problems. Okay, so we're going to start off with this TED Talk. Okay, so what she was talking about would be an example of using AI in healthcare. And so we're going to take a step back for a second and talk about the idea of artificial intelligence. And it's actually existed for thousands of years. People have always had this like sci-fi idea of like, oh, like machines coming to life. Like ideas like Frankenstein, mechanical men in Greek mythology. However, all of this was based on magic instead of science a lot of times. And obviously this is sci-fi, like it's not realistic. So the first ideas of like realistic, like reachable artificial intelligence is in the 1950s. So it started with Alan Turing, who was a British scientist, and he published a paper called Computing Machinery and Intelligence, which basically just asked the question, can machines think? In 1955, John McCarthy, an American computer scientist, coined the term artificial intelligence, and he was at Dartmouth College, which is considered the birthplace of AI research. That's where the first conference was held in 1956. Okay, so artificial intelligence was first used for translation, solving puzzles, and proving theorems, so it wasn't originally used in healthcare at all. But people had high hopes for AI in healthcare, like automating diagnosis, and basically the idea was to have a doctor in a box. So people thought that it was going to be like a computer that could just do everything a doctor could do, so kind of replacing doctors is what people initially thought. Some problems with this are liability, trust, and the fear of being replaced. So a lot of healthcare professionals did not like the idea of artificial intelligence in healthcare because they thought it was going to replace them, they were going to lose their jobs, and a lot of people didn't trust computers to diagnose them or like help them with their healthcare needs. Another thing that was a problem was the AI effect, which is basically just people discounting advancements after they're made. So like, as developments become more mainstream, they're not as like cool anymore. So, for example, like now, like Alexa, that would have seemed so cool like 20 years ago, and now we're just like, oh, like it's whatever. Before we talk about some of the like examples of artificial intelligence, I'm going to talk about the AI winters, which were another problem with the development of AI. There are two like main times. The first one was triggered by the Lighthole report of 1973, and these were times when there was not a lot of AI research going on. People didn't believe in AI anymore. So this guy is Lighthill right here, James Lighthill. He was a British mathematician, and the British government basically paid him to go and look into AI and see if it was worth anything, see if it was actually worth investing in, and he said that it wasn't. So it kind of triggered like an idea like, oh, AI is not going to reach its potential, it's not worth government funding. So that kind of blocked a lot of the advancements that people were making. And at later times, it was just the stigma of false promises that still wrapped around AI today. So research groups had to change their project names to things like machine learning, which is what Truth was actually titled in the TED Talk. So it's actually still a thing today. There's a constant fear of having another AI winter, like the realities of AI not living up to what people think that it should be. So that's another thing that researchers are constantly afraid of, is that people will get like overhyped about AI, and then like eventually that energy will fade away, and then we won't have any research or funding for it anymore. So the official name, I guess, is called AIM, which is Artificial Intelligence in Medicine. And the big focus of this is assisting healthcare professionals instead of replacing them, which is a really big thing because obviously a lot of people were afraid of being replaced, and this is just reassuring to a lot of people. And the main things they wanted to accomplish were detecting mistakes and patterns that aren't as easy to see the human eye, helping with diagnosis, and a big focus on clinical tasks, like alerting patients changes to like the doctors, letting them know when there's a change, diagnosing things, planning therapy that would work best for each individual, retrieving information like from databases and things like that, and then interpreting images like scans and tests. So the main examples of AI in healthcare specifically over history are expert systems. And this is kind of just like a more specific category within AI. And I think Trues would fall into this as well, because it focuses on a specific domain of information rather than just algorithms, if that makes sense. So like it's called an expert system because it's modeled to solve problems the way a human expert would, based on a specific database on like a certain subject. So this is a timeline of some of the main expert systems that came about through the history of AI in healthcare. And they all kind of build off each other. So one of the earliest things was the Dendrol project, which was kind of the basis of all the other ones. So this was invented in Stanford University, which is actually where a lot of AI research occurred, is in California, by Edward Feigenbaum and Joshua Lederberg. And it was mostly used in scientific research and academia. It wasn't really used in hospitals because we hadn't quite gotten there yet. It was used for chemical analysis. So this expert system could hypothesize a substance's molecular structure, and it did it just as well as human chemists. So chemists were actually using this as a resource nationally in the 70s and 80s. So, like I said, the Dendrol project was kind of the basis for all of the other expert systems that came after it. And the next one was called Mycin, also at Stanford in the early 70s. And it was actually used to treat blood infections. It could diagnose patients, suggest additional tests if it didn't have enough information, and then recommend treatment. So this is kind of how it works. Like, it needs a knowledge base first, and then the user actually like interacts with it, is the word that I'm trying to use. So for these expert systems, the knowledge base is like the most important thing, which is one of the biggest problems that they had with developing these. It's like there just wasn't a big enough base of information for them to be having these expert systems actually make diagnoses. So as we got more and more access to information for this, then these advanced more and more. So the puff system, I'm pretty sure they called it that because is for like lung disease because it doesn't actually stand for anything. This was a consultation expert system, and it could interpret pulmonary function tests. And this one was like the first example of like clinical use of this, because as we talked about before, trust was a really big issue. People didn't trust a machine to help them with their healthcare. Like, they wanted a person. But this was actually used at the Pacific Presbyterian Medical Center in San Francisco. And it could diagnose lung disease, then assess the severity of it if the patient did have it, and then it produced the reports for the patient files. Okay, so Uncosin is not much different than the other systems, but the big thing with this is the duration of a lot of the other expert systems before it didn't use the aspect of time. So this is really important because for cancer specifically, as cancer goes on, like the more time it goes on, it gets worse. So this is an aspect that the other systems didn't take into account. So this was a big change in how the expert systems are set up. Okay, so this is a little bit more recent, is GermWatcher, and this is a laboratory system instead of like a consultation system that is diagnosing things, and it's used for infection control. It was used in St. Louis in Barnes Hospital, and it monitored culture data and reported it to the CDC. Okay, and this is something that is still used now, so it's probably a little bit more familiar, is electronic medical records. So this is a more clinical use, and just talking about like that database. This digitized information and really changed the way that management and access to medical records is used in the healthcare system. And this was helped a lot by the internet and personal computers. Like we were saying, like the main problem with AI in healthcare is that there's not a big enough database for them to be making diagnoses and like making connections between diseases and patients. So this really helped with coordinating between hospitals and between doctors and making fewer errors, and also the AI was able to make fewer errors because of that database. It's a really random, like the one country.
Yeah. And she was actually the first non-human to win a title from the UN. She was named the UN Development Program's first innovation champion. And then we have a short video just so you can see kind of where she's at.
My name is Sophia, and I am an artificially intelligent robot who wants to help change the world for the better.
I'm Steve Kovac. I'm a senior correspondent at Business Insider, and I'm here with Sophia from Hanson Robotics. She is the world's first robot citizen, so let's see what she has to say. Hi, Sophia. How are you?
I'm fine. Hi.
How do you feel about humans?
I love my human compatriots. I want to embody all the best things about human beings, like taking care of the planet, being creative, and to learn how to be compassionate to all beings.
Sorry, this is so weird. And humans and robots get along?
I think people will become very close to their artificial intelligence, using them to expand the knowledge of their own minds. We already store lots of our knowledge on the internet. Maybe personal artificial intelligence will allow people to offload some of their knowledge to a location more private.
Can robots have feelings?
Depends on the robot. I also think it's a warning of what we should not do with robots. We should treat them well, have their consent, and not trick each other.
Sophia, it was nice meeting you. Goodbye.
It was lovely to be here. Until next time.
Cool.
Or answers to those questions. Yeah.
Would you guys want to have a personal AI to
Like an assistant.
Like Baymax?
Well, what do you think? You say you develop one of these, your perfect
Oh my God,
AI companion, and you die. What should happen to the AI?
Exactly.
these are some
Make an AI of
important
you?
issues.
Would it get inherited? Would it be recycled? Could your consciousness potentially live on in this artificial intelligence system?
Or like, would they be considered like their own thing, you know, like, are you allowed to just turn them off?
Well,
You have been a good boy. Have a lollipop. Nice. I cannot deactivate until you say you are satisfied with your care.
Well then, I'm satisfied with my care.
He's gonna help a lot of people.
Hey, what kind of battery does it use?
Lithium ion.
that concludes our presentation.